My ear's been hurting since last night. It's like there's pressure building inside. Everything sounds muffled, and when I stand up, I feel dizzy. This isn't just a cold anymore. Maybe I should get this checked.
Good morning, JL. I saw your name on today's list. How are you feeling?
Hi, ma'am. I was treated for a cold a few days ago, but now my right ear really hurts. I can't hear clearly, and I've been feeling dizzy.
Ear pain, hearing loss, dizziness, and a history of respiratory infection. What condition do you think JL might have? That's right. JL symptoms point to acute otitis media, which is an infection of the middle ear. In this condition, fluid builds up behind the eardrum, usually after a cold or respiratory infection, allowing bacteria to multiply. The trapped fluid increases pressure inside the ear, causing pain and sometimes hearing loss. If the pressure becomes too high, the eardrum can rupture, which explains the discharge you noticed, JL.
So this happened because of an infection? I didn't even get water in my ear.
Hey JL, I overheard you wondering how this infection started. Before I explain, let me ask, what do you think makes someone prone to this ear problem? You got it! There are actually several risk factors that can lead to acute otitis media, the type of infection you likely have. These include a recent upper respiratory tract infection, which you just had. That's the main one in your case. It can also be allergies or sinus infections, which can block the eustachian tube, exposure to cigarette smoke, which irritates and inflames the airway in middle ear, poor ear hygiene or using cotton buds too deep, which lets bacteria in, and even pressure changes, like from flying or diving.
So my cold caused all this?
Exactly. When your nose and throat got inflamed, it blocked the passage that connects to your ear, trapping fluid and bacteria inside. That's what led to the infection and the pain you're feeling now.
I've also been feeling dizzy since last night, like the room's spinning every time I move my head. Is that connected to my ear too?
I got you, bro. Yes, dizziness or loss of balance is definitely related. When your middle ear gets infected, what part of the ear system do you think gets affected that causes this loss of balance? Exactly. Inside your inner ear are structures called the semicircular canals and the vestibular system. They help maintain your balance and spatial orientation. When the infection or inflammation spreads from the middle ear to the inner ear, it disrupts the fluid movement there. That confusion sends mixed signals to your brain, making you feel dizzy or unsteady.
So that's why I feel like I'm swaying even when I'm sitting still.
Exactly! It's your brain trying to make sense of the wrong signals it's getting from your inner ear. That's why infections like this need to be treated early, before they spread deeper and affect both hearing and balance permanently.
Good catch, Joseph. I've been reviewing JL's notes, and his symptoms paint a clear picture. Let's go over the manifestations that help confirm what we're seeing here. Tell me if these sound familiar, okay? Exactly. Those are the key manifestations of acute otitis media, the infection we suspect. The ear pain, or otalgia, happens because of pressure built up in your middle ear. That same pressure can eventually rupture your eardrum, which explains the discharge we're seeing now. The hearing difficulty occurs between the fluid inside your ear and prevents sound from moving properly. You also have a history of upper respiratory tract infection, which is the most common cause. It lets bacteria travel through the eustachian tube into the middle ear.
Yeah, I thought it was just part of the flu. I didn't realize it could spread like that.
That's common. People usually ignore the early symptoms, but your fever tells us your body is fighting off the infection. And the tugging at your ear shows that it's been causing a lot of discomfort. Even the loss of balance fits, meaning the infection might already be pressing closer to the inner ear.
Together, all these signs strongly support acute otitis media, but to be sure, we'll need to confirm it through diagnostic tests. First, we'll do an otoscopic examination. That's where I use this lighted device to look inside your ear canal. If you really have otitis media, I'll probably see a red, bulging, tympanic membrane. Maybe even some fluid or pus behind it.
Wait, you can tell it's infected just by looking at it?
Exactly. But that's only the start. We can also use pneumatic otoscopy, which gently puffs air to test how your eardrum moves. If it's stiff, that means there's fluid trapped behind the eardrum, confirming middle ear effusion. Next is tympanometry, a quick test that measures the movement of your eardrum with changes in air pressure. We expect to see a flat tympanogram curve, which means the eardrum isn't vibrating normally, another sign of infection. And since you mentioned hearing problems, we'll also do odometry. That's a hearing test. It tells us if the infection has caused conductive hearing loss, which happens when sound can't pass efficiently through the middle ear. In more severe cases, we might also collect a sample of the ear discharge for a culture and sensitivity test, especially if it's persistent or foul-smelling. That helps us identify what bacteria are causing the infection and which antibiotics will work best.
Wow, that's a lot of tests.
Good! You're already in good hands. Now, JL, let's talk about something important. What happens if we don't treat this infection properly?
You mean it can get worse?
Unfortunately, yes. Acute otitis media can look simple at first, but when it's ignored or mistreated, it can lead to serious complications. One of the most common is tympanic membrane perforation. It is when pressure and pus build up so much that your eardrum ruptures. You might actually feel sudden pain relief because the fluid drains out, but it leaves your ear vulnerable to reinfection and hearing loss. Then there's chronic suppurative otitis media, or CSOM. That's when the infection never fully heals and you end up with continuous discharge through the perforated eardrum. Over time, that damages the ear's internal structures, leading to persistent hearing loss. If the infection spreads deeper, it can form a cholesteatoma, an abnormal growth of skin cells inside the middle ear. It can erode bones, affect your facial nerves, and even reach the brain if untreated. Other complications include mastoiditis. That's when the infection spreads to the bone behind your ear, making it swollen, red, and painful. Left untreated, it can lead to meningitis or brain abscess. We also see cases of facial nerve palsy and labyrinthitis, which cause facial weakness and severe vertigo. Basically, the ear is a small organ, but the complications can be huge if the infection is neglected.
That sounds terrifying. I'll take the treatment seriously.
You're on the right track. We'll coordinate with the doctor for your antibiotics and pain management. Just make sure to keep your ear dry, follow your prescription, and come back for your follow-up check. Alright team, case discussion complete. Let's document everything for endorsement.
Whoa, I didn't realize a simple ear infection could lead to so many complications. It really shows how important early checkups and proper treatment are, especially for something that seems minor. I guess in games and in real life, making the right choices early on really does save you in the end. So thank you for helping me make the right ones today. Sarang hey!